For most Cambodians, the advent of a fragile peace process has made little difference to their lives. There are many vulnerable groups, and for 90% of the people, it's poverty as usual. The Federation has been working in Cambodia for 2 years, and in 1992 was very active in 3 major areas: the smooth repatriation of over 200,000 returnees from Thai border camps, community-based health programs across 1/3 of the country, and drought relief for 100,000 people in 3 southeastern provinces. Them Krang, a farmer from a small village near the Vietnam border, saw his rice crop wither just a few months after the previous one was wiped out by floods. With the new harvest well established, he is collecting his final bag of rice at the last of 175 distributions organized by the Red Cross in Cambodia with support from the Federation. The 9-month operation has provided 100,000 beneficiaries with 75 million meals. As this final bag is wheeled away, it's a good moment for Federation Relief Delegate Jan Kiest from Netherlands Red Cross.
Well, it has been a very satisfactory program. We have provided more than 12,000 metric tons to the poorest people in Cambodia, and that's over the past 9 months about 75 million meals. That's quite a lot, and it feels good to have given that to the poor people. The Cambodian Red Cross have arranged the transport, the logistics, and they work really well together with the Federation.
At the opposite end of the country, a relentless trail of transport has been bringing back refugees from camps on the Thai border for most of 1992. Many have been away from their birthplaces for 13 years. The Federation, supporting the Red Cross in Cambodia as the implementing partner for UNHCR, has helped resettle over 200,000 of the estimated 330,000 returnees during 1992. 6 reception centres, like this one in Betacam, are managed by the Red Cross in Cambodia with help from the Federation's camp manager advisors. Returnees are first registered and then wait for less than 5 days in the clean, functional centres before moving to their new homes. Mother of 2, Ven Nguyen, who left Cambodia as a teenager, has made a fresh start in a village near Betacam with her family. She says she is pleased to be back and appreciates the help of the Red Cross and the other aid agencies. Advisor Henrik Olsen from Danish Red Cross says this about the operation.
I think it has gone a lot better than it was to expect it when we started. I think at the same time there are a lot of lessons to be learned in this, but as a whole it has been we have seen far better results that we could have expected before we started. Very little demining has been done. This was a thing that we all believed in the very beginning, that demining would be a forerunner for the work we were going to do, especially with locating land, cultivation land, etc., for the returnees. Once they arrive at their final destination, they are housed, they are fed, we could say, for 400 days with an interval of 40 days between each ration. We do our best to monitor all the final destinations, make sure that they're all right, that there's at least a reasonable level of health, their health is okay.
But as they depart for their new homes, the returnees are coming back to a country with its health service in disarray. The Federation has district health support units attached to each centre and operating in 2 other provinces. Their work is community-based and involves direct contact with vulnerable groups and includes primary health care, sanitation advice and immunisation. Training is another vital aspect of the programme and also covers first aid courses like this one, where 2 volunteers are taking part in a mother and child health exercise. Annette Scarf, sponsored by Australian Red Cross, sees funding as the major factor for success.
Well, at this moment, we have funding just for 1 year. If we want to establish a program that is viable, we have to look to long-term program funding that will take us into 1997, maybe would be viable. We need to be able to establish trust, which takes a long time. The sanitation portion of the program will be in itself expensive. The village that we're in at the moment, we're doing a sanitation assessment on. There are 250 families here taking water from a dry riverbed and with no latrines anywhere in the village. So to make even inroads into the sanitation program in the 15 villages that we're assisting is going to be a very expensive business.